See pretty well, but if I want to see that backside, I can flip my mirror upside down and cup that back tooth, and I can see the back of that tooth in the mirror. And I prefer to use the clock position method, so I'm not moving around the patient's head a ton. I lifted her chin up and turned a little bit to the left for me, and I can flip my mirror around again and cup that wisdom tooth so I can see the back. I'm still using an extraoral fulcrum, which allows me to see a little better. Now, if I have an assistant helping me, I would be calling out these numbers in threes. So that one I would say 323. For the buckle aspect, I'm gonna have Shelly turn a little towards me and open her jaw and drop her chin to her chest a little bit. And I'm gonna have Shelly put her tongue to the right side, or left side, there we go, thank you. And I can see really well. Still using an extraoral fulcrum. I just switched to an extraoral. I can also use an intra, just like this. Okay, so now I'm here at 11 o'clock to do the posterior away surfaces. So I'm going to have Shelly turn to the right and lift her chin up so I can see the lingual aspect of quad number 1 really well. And I'm taking the mirror and I'm coming straight down. I have a fulcrum with my mirror against her cheek, and I'm going to come back and cup her wisdom tooth. Now I'm using an intraoral fulcrum and coming across. There we go. If my probe depths are the same for multiple teeth, I continue probing until it changes. So I will probe an entire lingual surface as I'm getting 323s consistently. Then I'll pause, put them in the computer when I've reached a 4 or a 222. So I'm not stopping after every tooth to document. Facial aspect, I'm gonna have Shelly close just a little bit. As she closes, I have more room on her cheek, her buccal tissue to pull out. I'm gonna have you open really big for me, Shelly. When she's opened really big, I can't pull as much, but if she closes a little bit, I have a lot more leeway to pull. So here, I cannot see the lingual aspects. I'm gonna flip my mirror, cup that back tooth so I can see. I'm still using an intraoral fulcrum right now. I'm using indirect vision. I'm using an intraoral fulcrum, and I'll be following my retraction towards the tooth that I'm working on. It's important that we stay in the sulcus. You will not be getting a correct reading if you are not in the sulcus. And to get in the sulcus, sometimes when it pops out, I just take the probe and I jiggle it side to side so I can slide in a opposite arch fulcrum. So I'm going to be fulcruming on the occlusal surface of quad 1. I'm going to take my mirror, I'm going to cup her tongue, and I'm using indirect vision to see my probe depths. Indirect vision again, gotta love it. Right, so here I am sitting at 12 o'clock. I'm gonna just take my mirror and I'm gonna swipe it on the inside of Shelly's cheek so I get it nice and cleaner. Nice and clean, that's what I wanna say. So here I am at 12 o'clock and I'm just gonna start on the facial surface, and I'm just going to use an intraoral fulcrum and probe all of my surfaces, both towards and away, here at 12 o'clock on her anterior teeth. And I'm gonna flip to my lingual side, indirect vision for the win. I'm gonna come here, start at the canine. And all the while I'm watching my patient and my probe to make sure that I stay adapted. Your patient will know if you are flaring too much or not enough, and they'll feel a little pinch. I usually like to tell my patients, if you feel a little pinch, please raise your hand and I can adjust my instrument. Her chin to her chest, and I'm going to take my thumb and retract. I'm going to place my thumb in the vestibule so I can see really well. 12 o'clock still, using an intraoral fulcrum and indirect vision, so I don't have to stand on my head to see things or twist my body like a contortionist to see things. Indirect vision is a skill that you want, you need.